and gentlemen, I am going to give you good news and bad news. The bad news is we are too fat, which is incredibly unhealthy and will make us sick. Almost half of us is overweight. Back in the 90s, that was 30%. Today, this has increased to 50%. This increase over the many years is extraordinary. This also brings me to the good news, though, because if it wasn't always like this means it doesn't have to be like this. And apparently, we can do something about it. But we must realize that the problem as a consequence of the obesity epidemic is very serious. It means that a lot of people are getting all kinds of diseases, such as cardiovascular disease, cancers, diabetes, which affect their daily lives, which is completely unnecessary. For patients, having a disease is not just the loss of health. It is also the loss of control, of self-confidence, of work, of financial security. For organizations, diseases mean a loss of work capacity. Sick leave is very expensive and it leads to an extra workload and pressure for the remaining employees. And in addition, employers are facing an increase in sick leave and disease, while at the same time the government is asking all of us to work until older age. Something is wrong, it seems. I am an occupational physician at one of the largest hospitals of the Netherlands. I'm surrounded by doctors and patients who are busy fighting diseases every day. And when I started my PhD research a couple of years ago, I first wanted to look into the major cause of all these diseases. And what I found out is that of the non-infectious diseases, almost 80% was lifestyle related. That is enormous. So then, I looked into lifestyle medicine. Lifestyle medicine is an upcoming field. More and more is known about the beneficial effects of lifestyle medicine. It is a way to prevent diseases and to reduce the severity of diseases. Less pills, less complications. This is what we call prevention. And let me tell you what happened to me the other day. I was sitting in my office at my desk, and I was just wondering and waiting for sick hospital employees to come in and see me. And then I asked myself two things. First, if prevention is the key to health, why don't healthcare professionals come in to see me for advice on how to stay healthy and fit for the job? Is it maybe because they don't need me? Because healthcare professionals just aren't fat. They know how to take care of themselves. They have the perfect BMI, they exercise regularly, and they sleep regular hours. I wanted to find answers to my questions. So I decided to get out of my office and go for an exploration around the hospital. And I visited clinics, and I visited outpatient clinics, cardiology, oncology, and I went to several labs. And guess what I saw? I saw overweight and obese employees, the same as in the rest of the Netherlands. And I didn't see healthy behavior. I saw unhealthy behavior. We're eating too much. We're too fat. We don't exercise regularly. And we don't sleep well. And we're always stressed. So this gave me a profound insight, which I will share with you. Knowledge alone is not enough to get people to change their behavior from unhealthy to healthy. I saw tons of healthcare professionals who know all about a healthy lifestyle and are still behaving in an unhealthy manner. Many people say we have to do more health education, but that is not going to pay off. Let's dare to say it out loud here. Prevention by giving more information, by shouting out harder what is best for people, by pointing our fingers and saying, "Thou shalt not smoke, thou shalt not eat any fatty hamburgers," will not pay off. It is a totally flawed idea that people would not eat a Snickers, for example, if they knew how many calories were in it. And the reason for this is that we make our choices based on short-term incentives. We eat the Snickers right now because we crave it right now. And in the short term, there are no reasons not to eat it. In the long run, there are many reasons not to eat it. But those may be so many years away, and you might not even be alive by that time anymore, you might think. Organizations, doctors, and people all reason based on short-term incentives. We all behave in the same manner. For doctors, there's an extra complication. Because disease is big business, and prevention is not. We are paid to be reactive. We wait until someone develops a disease, and we respond to the consequences, such as burnout, depressions, diabetes. That's what we get paid for. But for patients, it's much too late. Serious harm has already been done. And the way back to recovery is so hard. So we respond to the consequences instead of the cause. Lifestyle. This is the perfect storm. People don't feel the urge to resist the Snickers or go to the gym, and doctors don't feel the urge to really help them change their behavior. We are all trapped in the same prison, all in favor of lifestyle medicine, but no urge to change. People just get the urge to change if they feel short-term incentives. So how about we exchange these stickers by something else? That would be interesting. There are processes so much stronger than our conscious, aware, and knowledgeable brain. We need to start influencing these unconscious processes. And what are the true drivers of people's behavior? People want to have fun. They want to belong. They're sensitive to their environment, to competition, to being rewarded. These are the factors that we need to influence. Let me tell you about the Efteling, where this was done incredibly successful. The Efteling is a theme park, just like Disneyland. And every theme park struggles with trash being thrown on the ground. It creates a messy appearance. And it frustrates the visitor who is expecting an almost perfect magical experience. And so many years ago, the Efteling tried to make it fun for both kids and adults to throw away their trash. I'm sure all Dutch people know it. It is hollebolle gijs. And when you throw in your trash, this is what you hear.
Hier, papier hier, papier hier. Hallo, hallo, hallo. Dank u wel.
So by introducing a talking trash can, throwing away became fun. People changed their behavior without it seeming like a chore. This inspired me to make healthy behavior fun, because I think that this is truly something that is going to make the difference. My team wanted to make healthy fun by using technology and gaming techniques combined with face-to-face care. So we built a game to help people lose weight and stay healthy. And in our game, we used the fun factor traveling combined with health behavior. And what we found is that people lost 6 kilograms of body weight on average and 6 centimeters of weight circumference, which is amazing. But I got even more excited when I noticed that all participants behaved above the physical exercise health level for the entire duration of the game. In our game, we used modern technology, such as quantified self, gamification, social media, and it can be played by using the smartphone. The game is played over a duration of 6 months. 2 teams virtually travel around the world, competing against each other for conquering continents. Every participant wears an activity tracker that measures their daily level of activity. And by moving more time or more intensely, the team gains more points and the individual as well. This is a screenshot of the game. And here you can see how they are traveling the world, and they just passed Europe, and now they're conquering over America. And over the next couple of months, this is what will happen. So it's a competition between teams. In our game, we used rewards, social bonding, and nudging as short-term incentives that led to long-term goals. Team members were encouraging each other to take the stairs instead of the elevator, for example. But the most exciting point was that they reached their health goals while being happy and having fun. Ladies and gentlemen, prevention is essential for eradicating diseases. We are helping people prevent diseases that may be 10 or 20 years away. This long-term goal may not be something that motivates people to take the stairs today. And that's why gamification is so important. But this will only be successful if doctors dare to broaden their scope. Let's proactively collaborate with other health innovators. Let's blend medicine with technology for the best of both worlds. I look forward to the moment that I once again go for an exploration around my hospital, hoping to see healthcare professionals who are healthy, vital, and productive by our proactive and preventive approach. Thank you very much.